The confirmation of that tomorrow, as always. Having said that, I'd like to give the floor now to Balázs, who will tell you the latest on the European Commission's efforts to combat COVID-19.
Indeed. Thank you very much. I have an update on the developments related to the COVID-19 outbreak for you. The European Commission is working around the clock to support EU member states and strengthen international efforts to slow the spread of COVID-19. We have today announced a new aid package worth €232 million to boost global preparedness, prevention and containment of the virus. And following the developments in Italy, the Commission is also stepping up its support to Member States in the context of the ongoing work on preparedness, contingency and response planning. Commissioners Kyriakides and Lenarcic held a press point earlier this morning to update you on the EU's response to the COVID-19 outbreak. If you were not able to be there, I invite you to watch the recording on EBS, where everything is available for you. You will find more information as well in the 2 press releases that we have published in the past 2 days, as well as in the Q&A online, but also in our daily news.
Thank you very much, Balázs. We are now ready to start your questions.
The President has been in close contact last Friday with the Slovak Prime Minister Pellegrini, that now is hospitalized with high fever and breath problems. I would like to know if she's got any information from Bratislava to take a precautionary measure for the contact that she had with Mr. Pellegrini in the summit.
Thank you very much for the question. I can confirm that the President feels well, and she wasn't informed about any precaution that she should take in relation to her meetings that she had at the European Council, not even with Mr. Pellegrini. C'est pour Balázs, Christian? Vas-y.
Christian, is this for Balázs? Well, the question we just had was actually a very good one. The European Commission and its delegations travel all around the world. There's an epidemic on the go, developing in different parts of the world. So I wondered what measures you take when people return from overseas travel. Are there particular precautions which you take, quarantine measures when returning from at-risk areas, such as China or Korea, amongst others? I'd also like to know if you are considering a reduction in overseas travel for the more vulnerable members of the Commission, such as Mr. Borrell, who is the oldest member of the Commission and could, in his post, run the risk of catching the virus, and that could be a grave risk for him at his age. So I wonder, are you going to reduce overseas travel? I believe that there's a preparatory summit in Beijing to prepare the summit with China, but there have been different interpretations and indications. Some people say it's going ahead, others say that it won't go ahead. I know that it's a diplomatically difficult thing for you to announce, but what is your thinking? Thank you. Well, it's a complex question with a number of different facets to it, Christian. Balázs can inform you regarding the measures which we take for travel overseas to areas at risk or areas close to outbreaks of the epidemic. Firstly, I can state clearly that we don't have any special measures in place for Mr. Borrell. Regarding the first part of your question, more specifically, and China, Hong Kong and Macau, missions by staff are going to be limited to only essential travel. Regarding members of staff returning from these 3 territories, evidently we offer them the opportunity to work from home for a period of 14 days. Thank you. For China, I'm going to ask Peter to come up to the podium to provide a few clarifications. But first, are there other questions for Balázs? I don't want to make him get up and down multiple times. Jennifer, you have the floor.
Thank you. I had a couple of questions. Firstly, on the announcement you've made on the funding, which says a 232 million aid package. Part of it is subject to the approval of EU budgetary authorities. Can you say how much is still to be approved? And presumably those EU budgetary authorities are the member states. Could you just confirm if that's the case or not? And then I had another question on the Schengen zone, which I'll just put that now. So that question is, have you had any contact from the Austrian authorities about closing or introducing border controls on their border with Italy? And are you issuing any guidance to member states on reimposing border controls in the Schengen zone? Thank you.
Now, on the Schengen, which is not entirely my competence, but I can maybe repeat the comment that was made by Commissioner Lenarcic earlier this morning.
Actually, yes, we will complete that.
We will complete that later. So all I can tell you from my side is that measures taken by member states to contain and limit further the spread of COVID-19 should first and foremost be based on risk assessments and scientific advice, remain proportionate and be coordinated with other member states. Now, on the question that you raised regarding the funds, so I will just offer you a very brief breakdown of the overall amount of 232 million, of which 114 million will be going towards the WHO. 15 million are planned to be allocated in Africa, including to the Institute Pasteur Dakar in Senegal to support measures such as rapid diagnosis and epidemiological surveillance. And there is also an amount of 100 million, out of which 90 million will be devoted to public-private partnership with the pharmaceutical industry for research purposes. And there's also an amount of 3 million allocated to the EU Civil Protection Mechanism for repatriation flights, which have been organized recently. Now, in terms of the technicalities behind these amounts and how they effectively will be mobilized, let me get back to you in the afternoon with the technical details.
Just to make it easier, I will take all the questions for Balázs, and then we will go back to the question on China and to the question on Schengen from Jennifer. Pascal.
Good afternoon. I'm from France 3. Could you give us some more details on the way the situation has been developing in Italy? Have the Italian health authorities provided any specific information to you as to how the virus got to Italy? Because direct flights to China had been stopped. So obviously we could be talking about indirect flights. And my understanding is that there was a meeting of the Health Committee this morning. Could you tell us what's happened since then? Maybe you could let us know something about the structure of that Health Committee while you're at it. Now, that's a question for another colleague who is responsible for more health issues. So it's a bit difficult, I know, to get questions narrowed down to this particular spokesperson only, because I know a lot of other people will be interested in the health angle. So we'll get Vivian up here to deal with those first. Thank you, Balázs.
He will be back, don't worry. He's here to stay.
Thank you. En ce qui concerne l'Italie, nous sommes...
As far as Italy is concerned, we are, of course, in touch with the Italian authorities. Commissioner Kyriakides has been speaking to the Italian Minister Speranza. And those contacts occurred last week as well, of course. So we've been well apprised of all the measures which Italy has taken in combating the virus. We've also had contacts at technical level between the Commission and the Italian authorities, as well as the European Centre for the Prevention and Control of Illnesses. And, of course, the World Health Organization. As the Commissioner pointed out this morning, there will be a joint mission involving these authorities to Italy this week, starting tomorrow. So we're in constant contact with Italy. We are keeping a close eye on what measures Italy has been taking. And indeed, it is true that there has been a meeting of the Health and Safety Committee which has discussed this issue as well. There you go. The meeting is still going on. We don't have any output from that meeting yet. Any other questions for Vivian now on the health side of things? I know it's difficult for you to specify those questions, but we'll try.
I don't know if it's for her or for Balázs, but you said that the personnel of the Commission who's coming from Iran and China, Korea, are advised to work at home for 2 weeks, if I understand well. Is this advice valid also for people, for personnel coming from Lombardy and Veneto in Italy, or not? Thank you.
I don't think that this is what Balázs said, but I can call him on stage again to clarify if there is anything in relation to advice, in addition to what he said before regarding trips abroad. So, Balázs? I guess this was the last question on COVID-19 on health aspects? No? Okay, we'll give it a try. Thank you, Balázs.
Donc, juste pour être clair, j'ai fait référence.
To be perfectly clear, I referenced 3 countries, Macau, Hong Kong and China. Thus, staff returning from those 3 countries, those 3 territories, have the option of working from home for a period of 14 days. Measures are in place for those 3 territories only, China, Macau and Hong Kong. It does not therefore apply to any other country, and in particular not to Italy. Is this another question for Balázs? Balázs, you talked about repatriation. I have a question for you in the context of what's happening in China, what was done in China. You are right that there are not very many foreign nationals in China compared to the number of European nationals in Italy. However, most foreign nationals in China were repatriated on specially chartered flights. The question that I have for you is whether it would be a good idea to start repatriating non-Italian European nationals in the parts of Italy which are suffering from this outbreak. I imagine it would be a very difficult process. Do you have anything to say? Well, I don't have any comment on that. As you know, there have been a number of repatriation operations from China and Japan. With regard to Italy, nothing has been planned in terms of repatriation operations. Therefore, I have no comment for you. Thank you, Balázs. Mosè, you're next.
Thank you, Dana. I also followed the press conference this morning with the 2 commissioners, and you said, both underlined that there were three conditions for imposing coordinated travel restrictions and border checks in Europe. And they referred to a credible risk assessment and scientific advice, but also said that they might wait for WHO for their advice. What I wonder is, the thing is that the World Health Organization had itself said that they don't have complete knowledge about the spread of the virus. And they still need to examine more how it is spread and about how long time it takes to being contaminated and so on. So I'm afraid we won't get any complete scientific knowledge about that for the time being. then you ask yourself, are you not supposed to take precautions to prevent the spread of the virus in Europe without waiting for that? And also wonder if not the Commission has its own scientists to advise it on what should be done at this moment.
I think it's a question which brings many things together, including some bits which are covered by Balázs, but it's mainly a question related to international preparedness regarding these epidemics and the role of WHO and the information that it would have in order to make informed decisions. Well, WHO is the world instance in terms of health matters, and we need to rely and to take into consideration its advice. Its advice at this stage is that no such travel restrictions should be introduced, but they are watching the situations very closely, as we are following it very closely indeed. And indeed, we have an agency, the ECDC, which follows the situation. And as colleagues have been saying, there will be a joint mission by our agency and by WHO experts to Italy to take stock of the situation there and to provide further advice. But as we say, this is a situation where we need to base actions on facts. We need to avoid taking rushed action if there is no justification for them. But of course, we need to be ready every moment to take very rapidly action in order to be prepared and to prevent the further spread of the epidemic. I don't know if Vivian, from the perspective of health, WHO would have anything to add to this, and from all other perspectives, Balázs. No.
Not much, frankly, at this stage.
Thank you. Lorenzo was next.
It's actually a follow-up to the question concerning the Brenner case yesterday, where there was the Austrian authorities decided to stop a train. Then finally it was allowed to go after some controls. My question is, I understood the answer that the authorities have to base their own actions on risk assessment, scientific advice, and coordinate them. Now, my question is on coordination. I would like to know whether you have, the Commission or the EU in general, contingency plans for suspending the free circulation, or anyways submitting the free circulation of persons to controls at the frontiers in case of like this, of outbreaks of viruses. So do you have contingency plans? Is there a sort of book of rules, what to do? Are the member states obliged to tell the Commission or the other member states what they are doing? What do they have to do when they feel that they should start controls at the frontiers?
Thank you, Lorenzo. This is indeed pertaining again to Schengen, so that's why at this point I will invite Adalbert, who also owes an answer to Jennifer on pretty much the same question, to take it from this perspective. Thank you, Balázs.
Thank you very much. Indeed, a lot of multifaceted questions today, so I hope I will be able to illuminate one facet of that, but probably not all of it. So for Schengen, first of all, on any notification by any member states, we have not received any such notifications for temporary reintroduction of border controls due to the COVID-19 outbreak. That's one thing. The other thing is, I think, as Commissioner Lenarcic and Commissioner Kyriakides said this morning, there is indeed the possibility under the Schengen Borders Code to reintroduce border controls based on public policy or internal security grounds. And from our perspective, any such measures would need to comply with the same conditions as other measures relating to this outbreak, which is being based on scientific advice and risk assessment, proportionate, coordinated on EU level. And right now, our advice to member states does not include reintroduction of border controls at internal borders.
Thank you very much, Adalbert. Any additional questions for Adalbert? Jennifer?
Thank you. Just a follow-up on the last point. You said our advice does not preclude border controls, but would you go, or did I mishear that, but would you go as far as actually to advise in, say, the Italian-Austrian case that border controls could be a good idea?
Sorry, I meant to say does not include.
Important. Please go ahead.
Angelo Di Mambro from ANSA. About the Austrian, and now there is a case on the frontier with France. It happened now. We have seen there is a reaction because people coughing on the trains or people coughing on the buses. So is this a coordinated response? What is the level, I asked it this morning as well, what is the level of coordination between member states bilaterally? Are you looking at that? What do you think about these happenings in which two people are coughing on a train and the train is blocked at the frontier? Thanks.
Thank you. I think that from the Schengen perspective, there is little to say on that, on how we react to suspicions of infection with coronavirus. And from the Schengen perspective as well, there is little to say about bilateral coordination between countries. I understand that you also asked the question to the commissioners this morning. Well, I hope you obtained a satisfactory answer, because we cannot go much further than that on this. As Viviane said, the Health Security Committee is meeting right now. All member states are represented there, and we are confident that at that technical operational level of this committee, any such coordination, practical coordination measures are being discussed, be it bilateral or EU-wide. So I think that on that, although the question is indeed very, very relevant, we cannot add much more at this stage. Well, I think that was all for Adalbert. No, that's for Adalbert as well. Please go ahead.
It's just if you can provide us a picture of the national measures which have been taken in the context of the coronavirus, because, for example, Italy decided autonomously to block the direct flights from China, but other countries did not. Other countries, if I am well informed, decided to impose a compulsory quarantine to people returning from China, and Italy did not decide in this sense. So may you provide us a picture of the puzzle, because it might have happened, we're not sure, but that the virus has been brought to Italy by somebody who returned from China, passing from other European countries, because indirect flights were allowed in Italy. So may you please us provide a picture of the national measures which have been taken in this context. Thank you.
Again, this is not a question for Adalbert, but this is something which Viviane can attempt to provide you an answer on. Thank you, Adalbert, because this is more linked to preparedness measures taken at the national level. Again, these are national measures, so we may not have a complete picture, although we are in contact steadily with our counterparts in the member states, and we expect such measures precisely to be discussed this morning at the Health Committee, which is ongoing.
Yes, thank you. So just to try to go through the different layers that we have. When we look back 10 days ago, we had the extraordinary council meeting of the health ministers, where the ministers said that they decided to have close and enhanced coordination to ensure the effectiveness of all measures. Then What do we have at operational level? At operational level, we have the early warning response system. The early warning response system is exactly there for member state experts, together with the Commission and the ECDC, to exchange information about new cases, about the measures that are being taken, about how you track the disease, and so on. And then this is where all the operational information is being shared, and then on top of that you have the Health Security Committee, which is meeting now, which is trying to put in place, or is putting in place, the general coordination, where you have the discussions on the more strategic level from the operational. So these are the sort of the exchange of information side. Then what do we do on the preparedness? We have, of course, the European Centre for Disease Control and Prevention. They are reviewing continuously what the member states are doing. The Commission on our side, we have asked them to review the member states' pandemic preparedness and response plans. Exactly what are the response plans in the member states for the COVID? And so now we're in a process where the European Centre for Disease Control and Prevention is reviewing what the member states have put in place. And on top of that, we're also doing a mapping of a surge of healthcare capacities of member states to make sure that those who need are ready to deal with the cases when they come up. So there is quite several layers of work on that already ongoing.
Operationally and at the level of exchange of information. Thank you very much. Vivian, are there any questions for Vivian? Catherine, do you think it's for Vivian? No, it's not for Vivian. Anything related to the health aspects of COVID-19 or any other questions that Vivian covers? No? Well, Christian, it's for... Sorry, Vivian? C'est pour toi?
I'm a bit confused here because we've had a lot of different spokespersons, and sometimes we get the idea that the briefings haven't been done in the best way possible to allow us to understand what's happening. But could I ask you this question? Are you happy with the measures which have been taken so far? Italy apparently is taking unilateral decisions to take measures which are just increasing panic. Bologna says, for example, that it's being put in quarantine. Everybody wonders whether you can actually go to Italy, how serious the whole thing is. Are these measures justified and proportionate? Nevertheless, they have been taken. Obviously, Milan is doing something similar. So you've got the whole north of the peninsula, a very industrial area, which has a lot of visitors. You've got all these various events and trade fairs being cancelled, and all of the people there are coming back north because they've nothing to do in Italy, and they're a bit worried, and they're taking trains and planes and cars and so on. So I'm just wondering what the level of your preparedness is and whether you think it's genuinely coordinated. I'm not pushing all the blame on you. Obviously, we've had a lot of pandemics in the past. You remember the mad cow disease, where things got out of control completely. One country decided one thing, two followed suit, and then there was an embargo. So how are you coordinating? Would it not be time, you think, to have meetings at ministerial level of the various health ministers, say the justice ministers, to deal with Schengen issues and so on? Because right now we've got a whole series of politicians who are basically just trying to make things even worse. I remember in the Southern Alps, where there were efforts to close the border, we have a head of opposition who was a minister in Italy, was doing something similar. So the question is, where are we going? And do you really feel that you're genuinely prepared? That's my question.
Pour tes commentaires.
Thank you for your comments, Christian. That's a question which covers a lot of different areas, as we've just pointed out. And it has implications with regard to health, civil protection. It also has a number of international and legal aspects to it, and involves the Schengen zone as well. Maybe the best way to do that would be for you to get in touch with the various spokespersons who are dealing with these individual issues, so that you can be fully updated on all of these various issues. That was in reaction to your first comment. As to the other questions, well, I think the colleagues have provided you with elements of a reply as to the state of preparedness, the state of exchange of information, and the operational situation. You had two commissioners this morning already give you their viewpoint and the viewpoint of the College of Commissioners as to the actions that need to be taken. As to the data we've got and the level of evidence we need to take decisions of this type, well, maybe Viviane may wish to add something to what she's already told you in attempting to reply to your question. Although be aware of the fact that there was an extraordinary meeting of health ministers just a week ago, and right now the Health Security Committee is taking place across the road. Now, in the light of the exchanges there may be other possible avenues to explore with regard to measures taken. Viviane, is there anything you'd like to add? Well, we always try to add things, but I think we've covered quite a lot of the various aspects of these files. If we take a look at the situation in the EU generally, the number of cases is very, very limited. Clearly, we are very, very worried about what's been happening in Italy. And this is why we have established close contacts with the Italian authorities. And this is why we're having this joint mission involving the WHO and the ECDC this week. And that's also the reason why the Commissioner is in permanent contact with the Italian Health Ministry, and so on. So we've got an exchange of information on the one hand, and on the other hand, we are constantly reviewing our member states' emergency plans, and we've got the views of the agency feeding into this as well. And then we have the meeting of the Health Security Committee, which is going on right now. And obviously that's a council body, and that's an issue for the council side of things. Let me just add that it's important to remember the role of the various players when it comes to managing an epidemic of these proportions. These roles are different. The Commission doesn't have the same level of health powers and competences as it does, say, for Schengen or for civil protection. It might be useful, therefore, to have a technical briefing to lay out for you specifically what the Commission's powers are when it comes to intervening and assisting, and what it can do to cover all of the various aspects of this particular situation with COVID-19. It's very, very important to clarify that each party must play, strictly speaking, its own role to be able to deal with the epidemic effectively. I imagine you've still got a question for Viviane?
Je comprends bien.
Thank you. I understand your attempt to explain clearly and to stick to the facts. I appreciate it, but I also understand the question from my colleague Christian, who was saying that the situation in Italy is sowing panic elsewhere as well. People are asking themselves questions. Can I still go to Italy? Can I go to Rome at Easter? Should I prefer a journey by car to a journey by train? Viviane, you said the number of cases remains very limited. It's very localised, it's low level, but the measures taken by Italy, observed from outside, are pretty big measures. Therefore, I wonder if what's going on in Italy is already a spread of hysteria, and when it will sweep through here. For example, next week, will we even still be meeting in a press room? Will we all have to wear face masks? I think that the question is a very relevant one. We need a response from an institution competent for these matters so that citizens, so that the public can understand what they have to do, if they should be calm, if they should stay at home, if they should avoid contact with other people. over on the other side of the street, they will say that the agency should continue with its research. They'll say that it's the WHO that has to give a clear line. But for the minute, we don't have a clear, easy to understand response on an issue which is of significant interest to millions of people around the European Union. And that's why I think that the question is a good one that we have to answer. I have a follow-up question for Balázs. I'll ask it now. The €232 million, does that cover money which has already been paid out for repatriation efforts, or is that entirely fresh cash? Thank you very much.
Laurent, merci beaucoup pour...
Well, thank you very much for your question and comment. But it's not a matter of whether the question is a good one, a relevant one or not. Of course it is. But it's not an easy answer. You admitted yourself in your comment that there are multiple facets to this. There are many different authorities who have their own responsibilities and have to act within their areas of competence at different levels. As we have said, and as the two commissioners said this morning, there is to be a joint mission between the WHO and our health agency. This will take place tomorrow in Italy. That will provide fresh, first-hand information, and I imagine at that stage we may have additional things to say. All of the member states are discussing these issues in the Health Security Council this morning. Fresh information will be shared and put on the table in both of those contexts, and I'm sure that we will then, after that, have more information to share with you. But for the minute, despite the relevance of your question, we don't have anything new to say yet. Thank you very much. Questions for Vivian? Health-related aspects? Right, I think this may be the last health question, because we do also have other issues to cover today.
Politico. The first question about the money for vaccine research. There are efforts to find a vaccine in the US, in Australia, in China. Will this European effort be coordinated with those, or is this particular public-private partnership happening in an isolated way? The other question, a bit broader. Is there a mismatch sort of between the message today about hundreds of millions going to the WHO and to Africa, when many people in Europe are hearing about the outbreak in Italy and feeling more anxiety about that? What would you say to people around the EU? We're hearing about shortages of face masks and that sort of thing in Romania and other places. What would you say to EU citizens who are worried about coronavirus in the EU?
Thank you. I think first about your question on the vaccine. Indeed, we've announced this grant of 10 million euros for the research and innovation program from Horizon 2020 to support the research on COVID-19. As you know, the Horizon is indeed an international program, so we can give you more details on that one later on. What I would say to the citizens of the European Union in general on this outbreak for the moment is that indeed Europe has been, or from the Commission side, we have been very much concentrating on the solidarity aspects, and we have been helping out also China where the outbreak started. When we now look at it, then of course you have various studies on it, including by our own agencies, which explain the excellent quality of healthcare in Europe. So from that point of view, when we look at it, we feel and see, and this is based on the facts, the member states' health systems are very well prepared to cope with these diseases. There are preparedness plans in place. There is a high level of quality in general, and so on. So from our point of view, we have, of course, full confidence that member states are doing what is necessary to make sure that people feel assured when it comes to their health.
Indeed, and on a more general note, I would say that it's not a question of either or. It's not about helping European member states and protecting Europeans, which is, of course, our first priority, and helping the rest of the world contain the epidemics and tackle it. We are in our roles in doing both actions, and we spare no effort to provide support to the member states. And it is also part of our role and of how the EU sees itself in the world to help address such epidemics at global scale, because in today's globalized world, Asia's epidemics is Europe's epidemics, which is also Africa's epidemics too. So it's very important to take action at both levels internally, which we do to the extent that we can and with all the means that we have, and to help the international partners address the epidemics to other levels. I think it's now high time for Balázs, unless there is a last question for... C'est pour Viviane? Pascal, c'est pour Viviane? C'est sur les...
Pascal, is this on the health aspects? Yes, indeed. A comment, basically. I think we've got to be cautious in what we say, otherwise we end up saying, using empty phrases, because it is true factually that there are very few cases in Europe at the moment, but at the same time you do realise that there are a large number of symptom-free cases of the disease, so we want to be cautious about what we say there. Just a question on the ongoing meeting of the Health Security Committee, which is still going on. At the end of that meeting this afternoon, do you think we'll have any clear picture of the traceability and how the virus ended up in Italy? In China, we know that they've basically lost control of the case. But in Europe, if you've got one confirmed case, you immediately have an inquiry trying to trace back that person's contacts with others and determine the source. So can we expect a reply this afternoon as to traceability in this case? Why have there been 4 deaths in Italy and more than 150 declared cases? So it's the issue of patient 0 in Italy. What can we say about that? Well, yes. The competent authorities are working on this, and we do have an early warning response system, which is precisely for that purpose, to gather information on traceability and determine how the disease arose in the first place. I cannot comment on the ongoing discussions for now, of course, but that is certainly one of the things the committee will be looking at. And we will attempt to disseminate the results of this meeting as rapidly as possible, as quickly as possible. That's a meeting which didn't take place in the Commission because it's not our mandate to do so. Thank you. I think maybe we've dealt with all of the health side of things. So, do you have another question on the health side of things for Viviane?
Sorry, just really quickly, a couple of things actually. One is definitely for Viviane, I think. Just being a lazy journalist here, would you mind telling us what the staff and budget is for the ECDC? A quick look online didn't reveal that answer immediately. So I wonder if you have that in your notes. My other question, I think, is for Adalbert, so I can ask it now or hold off. You're the boss.
Hold off, please. Okay. Thank you. Viviane, do you have the details of ECDC?
I will have to get back to you with these details.
We will get back to you on that. Thank you very much. Now I would like to invite Peter to give a long due answer to Christian, et merci pour t'inquiéter de la santé.
And thank you, Christian, for showing interest in the health of our High Representative. I can tell you he's doing very well. Peter has more on China. Yes, thank you very much. On Mr. Borrell's health, he's in good health. We are using the keywords prevention and precaution in all areas. On the EU-China summit, the decision will be taken jointly, mutually, that means the European and Chinese sides, and at the appropriate level. We don't have a fixed date yet, and once we have one, we will report it. Christian, do you have a follow-up question? There is a meeting scheduled at the end of the month of March, but over on the other side of the road, they say that an exact date has not been set. The Chinese ambassador says there is, so we wonder if this is just some sort of plan which has been put on the table and has never crystallized, or if there is something specific. The Chinese ambassador considers this to be in the schedule. He expects Mr. Michel, Ms. von der Leyen and Mr. Borrell to go to China on the 30th and 31st of March to work on the preparations for the summit. So I'd like to get a better understanding of that. Thank you for confirming that Mr. Borrell is in good health. I wonder if you will be going ahead with the Addis Ababa summit, or if there are precautions in the wings to ensure continued good health. Thank you. On China, I think that Peter will make another stab at clarifying exactly what he's already said. On the China-EU summit, there has been no announcement on a date. When we have a date, it will be announced in due course. On preparation, the meeting is part of the dialogue between the EU and China. There are many, many meetings and preparation meetings scheduled for the summit's preparation. Because of the situation, a number of these have been either cancelled or delayed. But there are always alternatives such as video conferencing or through other diplomatic channels. And we continue in communication with the Chinese partners using these alternative means of communication, be it video conferencing, as I said, or via diplomatic channels. Turning to the second part of your question, Christian, on the Addis Ababa meeting, as I said at the beginning of this press conference, the High Representative and the Commission President, and if I'm not mistaken, 22 of the members of the College will be travelling this week to Addis Ababa for the meeting with the African Union Commission. The meeting is going ahead as things stand. It will take place. Thank you for your patience, everyone. It took a while to get Peter up onto the stage because of the many and numerous questions on the coronavirus. And I don't think we're done yet. Any questions for Peter? Catherine? Not for Peter? Okay, then I'll ask him to step down. We had a question on finance for Balázs. Is your question also for him, Balázs? No? Then Balázs, finance, up on stage, please. The question was regarding the money announced today. Is it fresh money or does it cover money already spent to finance repatriation flights thus far?
Votre question sur le financement. Non, ici, le monsieur, je pense qu'il avait posé la question en français, donc je préfère répondre.
Okay, I'll reply to that question which was asked in French, first of all, before moving on. So, you were talking about the amount of 232 million euro. There's an amount of 3,000, says the Speaker, to cover repatriation operations. 3 million, the Speaker corrects himself. 3 million for the repatriation purposes. That's included in the overall amount.
Financing. I think what I would like to say is that the overall amount of 232 million euro will be devoted to, fighting the coronavirus at the global level. So this money will not only be used in China, not only in Asia. A great part of it goes to the WHO, and the purpose is to mobilize money to address the virus at a global level. And the same applies to the 90 million, which goes to public-private partnerships for the pharmaceutical industry. So we are talking about money which is going to be used globally, not only in a certain part of the world.
Thank you very much. Last try for Balázs. No, go ahead.
Thank you. So there's the 3 million for repatriation. How many EU citizens are still in one, or is this to kind of pay countries back for flights that already happened?
What I can tell you is that we have carried out a large number of repatriation operations financed to a large extent by the European Union and, facilitated through the coordination work of the Emergency Response Coordination Center. Also, they have been carried out in the framework of the European Civil Protection Mechanism. Now, if there is a need for us to organize additional repatriation flights, we won't hesitate to do so. From what I know, at this point in time, there is no such request. Should there be such a request, we shall not hesitate to act.
Thank you. Any additional questions for Balázs at this point on coronavirus? No, thank you. We had a question for Adalbert. Adalbert, please.
Hi, thank you. Just wanted to get into the nitty-gritty of the functioning of Schengen with regards to the diversity of, and it was touched upon earlier, diversity of members, policies or approaches to suspension of flights and mandatory quarantine. Is that not de facto a choice that members have made that hampers or fragments the functioning of Schengen, which, let's remember, is already kind of broken? And at what point does the European Commission have purview or responsibility to make some recommendations because of that? I think the colleague earlier mentioned we're speculating, of course, but mentioned the eventuality that someone who was unwell reached one member state and then traveled, visa-free without checks to Italy, and et cetera, et cetera. So it does seem that this is pretty pertinent to the functionality of Schengen, which I believe is your responsibility rather than the member states' responsibility. Additionally to that, we're just in the 1 hour that we've been sitting here, first of all, there's been a 5th person who's died in Italy. Additionally, a coach was stopped in France, arriving from Italy to France. So is there concern that de facto on the ground, Schengen is going to continue to disintegrate, even on the basis of passengers reporting other passengers? And would it therefore not be wiser just to get ahead of the problem and put in place some recommendations across the board? Thanks.
Okay. Again, a lot of elements to your questions. And actually, I have to say that only a very few of them specifically relate to the rules that govern the Schengen area as such. And a lot of what you've been mentioning relates more to travel restrictions and to measures relating to transport, which would be, again, the domain of my colleagues who have been on the podium already. As regards the Schengen area as such, I don't think I can say much more than what I've mentioned before, which is that internal border controls or temporary reintroduction of internal border controls are for the moment not part of what we recommend. And there is this possibility for member states to reintroduce border controls on a temporary basis, but it has not been used, and we haven't received any notification in this sense. And I would not necessarily make a link between temporary restrictions to movement on public health grounds and disintegration of the Schengen area. I think we're still very far away from that.
Thank you very much, Adalbert. C'est une question pour Adalbert? Christian?
Now, checks have already been set up, and I think they're still there. Can they be kept there, and can they be simply be moved or maybe have their names changed or whatever if you decide that there is a public health issue? We've got checks, and now we're going to keep the checks that we set up, say, back then for reasons of terrorism or whatever.
Oui, la manière dont ça se passe est que
the way things are happening is that if countries reinstate border checks, they must notify the Commission. In doing so, they must provide details as to the reasons why they're doing so. The checks currently in force were motivated differently, obviously. It wasn't a question at the time of public health. Now, if states want to continue the checks for those reasons, that would require a Commission notification, of course.
Adalbert? Is there also for Adalbert again? Okay.
Could you tell us a bit about what Frontex potentially can do in the context of this crisis? And I think I probably speak just for myself, maybe others have had enough, but if there is willingness for a technical briefing later today, you know, I would be there. So I appreciate that this is interdisciplinary and complicated for you guys. It is also for us. So, you know, we appreciate your efforts. We don't want to have a fight with you, not today, but we would really value technical input from your experts, possibly when this meeting that's been going on all morning is over and you have more to say. So let us know.
Thank you. Adalbert, if there is anything that you can or you want to say about Frontex?
To be 100% sure, I would have to triple check, but from my current level of knowledge, I don't believe public health issues are in any way in the mandate of the European Border and Coast Guard Agency, Frontex.
As to the technical briefing, we will announce you when we succeed in gathering the experts that can provide explanations on the multiple facets of this evolving situation. But thank you for your interest. Is it for Adalbert as well? Adalbert, you stay.
Can I ask, can you think of any cases from the past where border checks have been reintroduced as a result of public health grounds? Nope, it's never happened before. That was a simple answer. Such reasons have never been invoked to reinstall checks. Any more questions from Adalbert? No. Are there other questions for today? Catherine, you've had your hand up for a long time.
Catherine Fiore.